The 2014 Ebola epidemic. Have you heard the virus has entered the United States? Today I'm going to be talking to you about the Ebola virus. I believe that I'm qualified to talk about the Ebola virus because over the last couple of weeks I've been researching a lot of data on the Ebola virus, and with the current scare around the world, there is a lot of information out there on the Ebola virus. So I feel like I'm qualified to relay that information to you, and honestly, you are all at risk of contracting the Ebola virus, so it affects everybody. And the more we know about it, the better we can prevent it from happening to us. My thesis statement is going to be that prevention instead of treatment is the key at this point in the game for the Ebola virus, because there is currently no FDA-approved vaccine for the virus. First one I'm going to talk to you about is going to be the Ebola virus and how it spreads, and then I'm going to talk to you about symptoms and treatment, and then most important, I'm going to talk to you about prevention. The CDC states that the Ebola virus is a rare and deadly disease, and that it's considered the largest epidemic in history. It has affected multiple countries in West Africa, and they're saying that 1 in 2 people who have contracted the Ebola virus have died. The Huffington Post states, basically they gave me some information on what happens when you contract the Ebola virus, and they state that the virus goes in your body, it kills your cells, it causes heavy bleeding, it can cause your cells to explode, and it damages almost every organ in your body, and it wrecks your immune system. They're stating that the Ebola virus is highly infectious, which means that you only need a small portion of the virus to contract the full-blown Ebola. However, with that being said, it's not extremely contagious. The reason that it's not extremely contagious is because it's not an airborne virus. The only way that you can contract the virus is through direct contact, which means there has to be an exchange from one person to the next of bodily fluids, and you can exchange those bodily fluids through your eyes, your nose, your mouth, or an open wound on your skin. The CNN has reported that there is an incubation period of 2 to 21 days, and during that incubation period, if you are not showing any symptoms, then you're not currently contagious and you're not able to spread the disease. However, once those symptoms become present, then you are contagious and you're spreading the disease from yourself to other people. On the Mayo Clinic's website, they stated that some of the symptoms, which I found this really scary because the symptoms were similar to that of a common cold, and the symptoms that they listed are headache, sore throat, chest pain, fever, cough, fatigue, stomach pain, nausea, and vomiting. So if you have been exposed to the Ebola virus and you feel any of those symptoms come on, then you should get checked to make sure that you don't have the Ebola virus, otherwise you're spreading it to other people. And the CDC also states that there is currently no treatment for the Ebola virus. There's no FDA-approved vaccine, and there's no medicine to treat the Ebola virus. So currently, doctors and nurses, their only way of helping patients who have Ebola is to treat the symptoms. And with that being said, I mean that they're able to give the patients IVs, and they're giving IVs to stabilize or balance their electrolytes. They're checking their oxygen and blood pressure levels to try to keep them at normal ranges. And then they're treating any infections that are popping up due to the virus. With all that being said, prevention, I believe, is the key for all of us to avoid getting Ebola. And I found a website, it was on the CNN website actually, they stated that strict hygiene is very, very important for avoiding the Ebola virus. And one of the things they state for strict hygiene is to wash your hands. This is visual number 1, hand soap. Wash your hands constantly with water and hand soap. When you're not able to use hand soap, visual number 2, you should use hand sanitizer. So if you're not in a location where you can actually wash your hands, use hand sanitizer because it will kill your germs momentarily on your hands. Another thing they're stating is not to come in direct contact with people who have had Ebola or items that they have. And in West Africa, they're even telling people not to attend funerals and not to attend burials of people who have died from Ebola. They're stating just stay away at all costs. Don't go around it. And if you do feel like you've been exposed and you're experiencing symptoms, you should monitor yourself for 21 days to ensure that you don't have Ebola. If you do have symptoms arise, get checked right away so that you're not spreading the disease. The disease is very scary, but the more we know about the disease, the better we can be at preventing it and keeping it from spreading around the world. Thank you for listening.